I had a pain in my right jaw tooth. So went to my dentist, my general dentist, and they pulled the tooth, but when they pulled the tooth, they saw that it was a cyst under. They recommended for me to see an oral surgeon. When the initial diagnosis that it was a cyst, it could be cancer. We have to test it, and luckily it was not cancerous. It was just aggressive tumor that was eating away at the bone in my jaw. Eventually, the decision was made to have reconstructive jaw surgery.
Ryan had an ameloblastoma, which is a tumor in the mandible that's benign but aggressive and needed to be taken out. And so we were able to do that, but in order to do that successfully, we had to replace the bone that we took out. So our options were we can borrow some tissue or bone. In this case for Ryan, we borrowed it from the lower leg, and transplant in Ryan and to reconstruct the jaw. Often patients like Ryan come in with a lot of anxiety from a procedure like this, and that they're afraid they won't be able to return to their normal life, their normal daily activities, their job. Ryan is an active runner. He wanted to be able to dance at his wedding. He wanted to be able to speak at his job. He wanted to be able to get back to running.
So it was scary, I'm a big runner. This is kind of what I do to kind of let steam off. So I was very nervous about it. The surgery entailed, I guess, the entire day. Showing up at the hospital, getting prepared for surgery. I think the surgery was 8 hours, 8 to 10 hour surgery. The recovery, I think, is pretty fast for such a major surgery and kind of issue. And I would say my life immediately after surgery, 6 months, was easily just back to the person I was, doing the things that I do. But it was a pretty fast recovery that honestly surprised me.
I think people come to an oral maxillofacial surgeon to do this procedure because I think we're able to offer the full scope of the treatment. And by that I mean we can remove the tumor, the affected part of the jaw, we can harvest bone and we can reconstruct the part of the jaw that needs to be replaced. We can perform nerve grafting to return sensation to the lip and chin, and we can also place dental implants at the time of the original surgery or down the road to give the patient back their bite. And I think that's what patients really want when they come to see us, is that they want to really get back to the form that they were before they were affected by this tumor.
All my oral surgeons during this process have been, I think, remarkable doctors. They have been both direct with me, of telling me what's wrong, what can do, but not overly aggressive and saying, let's do surgery. Taking a much more conservative approach first, and then, kind of using surgery as a last resort. The doctors during the entire process were excellent.